It's after Valentine's Day, but it's Heart Month, Heart Health Month, cardiology. We're going to focus on a heart talk today. And we did this last February. I don't recall who all was here. Who remembers attending this talk last February? Good. Well, I got a lot of feedback on this particular lecture, so I said, it's Heart Month. We're going to do it again. So thankfully, the dollar store still had red balloons last night, and they had some heart-shaped candy. So this is not diabetes month, so you can have some candy to take home with you. Everything from little boxes of chocolates, little sweethearts, and some lollipops. There's a couple of folders up here if you need to organize some papers. They all have hearts on them. And then what else? We have heart stickers and heart pins. And I'm wearing my red, but if I get a little too hot, I might have to take this vest off. So we're going to get started this morning. For those of you who have not met me, I am Lori Saunders, and I'm the physician assistant that works in the Curana clinic here at River Landing. Our clinic is down the hallway. Turn right at the art gallery, and we are on the right across from the arts and crafts room. So we are an on-site provider of primary care. So if you don't have a primary care physician, need a primary care physician, or are looking to switch, then I'm there almost 5 days a week. They give me every other Thursday off to recuperate. And then we also have Dr. Kashana Blake, and many of you have met Dr. Blake. So we will frequently bring in other PAs or nurse practitioners to help out, such as when I'm on vacation, or today when I'm doing this lecture and have some meetings. We have Renee Middleton in the clinic. If you've met Renee, she is the PA that is in the clinic on Saturday mornings. So every Saturday, we have a provider there from 8 a.m. to 12. So if you have a new problem, something's popped up overnight, need to be seen, it's a walk-in clinic on Saturdays. So that's who I am. A little bit about me. I've been a PA for going on 26 years. This will be my 26th year as a PA. And I did spend several years working in cardiology, and we'll talk a little bit about cardiology and the heart, but you all may have already heard there are three basic divisions of heart health. There's structural heart, there's electrical heart, and then there are plumbers. So think of it like a house. You've got your contractor, and he focuses on the structure of the heart muscle, and the valves. The electrical doctor, the electrophysiologist, focuses on the electricity of the heart, and then the plumber focuses on the heart arteries, those blockages, and for people who need stents and bypass surgery, things like that. So I did work both in general cardiology and in electrophysiology during my time there. So again, this is what Curana offers: on-site primary care, sick visits, vaccines, blood pressure checks, preventative care, medication management. And what we're going to cover today are the main functions of the heart, fun facts about the heart, tips for keeping your heart healthy, when your heart needs help. So we're going to talk about complications of the heart, including some of the symptoms and treatment. So the main functions of the heart, most of you can imagine, it pumps blood. That's the first thing I usually, when I quiz people, they'll tell me, well, it pumps blood. So the heart is a muscle, and it is multifaceted. It is responsible for supplying oxygen-rich blood to the rest of your body and the rest of your organs. So it oxygenates blood. It also removes toxins from your bloodstream. So we need to take care of our heart. It's a very, very vital organ. Cardiac arrest is a real thing, and that's when your heart stops, and that's when you need possible resuscitation. The size of your heart is about the size of your fist. So if you just ball up your fist, That's the size of your heart, and it sits in the left side of your chest. It beats about 115,000 times a day. So again, we need to take care of something that's working that hard. A normal heart rate is between 60 and 100 beats per minute. I always, when I'm talking in the exam room, I use my hands a lot, and I use these parentheses, and I say, this is where most people live. Most people live between 60 and 100, but we know people fall below that, people are above that. When I talk about lab results, I use my parentheses also. I say, here's the normal range that most people fall in, but people fall below and can be above. So a normal heart rate is 60 to 100. If you are consistently below 60, let's say in the 50s, 40s, even 30s, and that is identified and accompanied by other symptoms, then you might be needing a pacemaker. And what a pacemaker does is it stimulates your heart to beat for you when the electrical system of your heart does not appear to work normally. Our heart weighs about 1 pound, so think about 1 pound of ground beef. Ball it all up in a fist, and there you are. It's a well-coordinated pump. It has its own electrical system, as I've mentioned. And heart disease is the leading cause of death in the United States for both men and women. If you have a heart murmur, people always say, well, I was told I had a heart murmur. A heart murmur is when the valves of the heart are opening and closing, and it's an abnormal sound that we hear when those doors of the valve or leaflets don't close and approximate normally. So again, there's many functions of the heart: oxygenating the blood, and prevention of stroke and heart attack is extremely important. Let's see, clicker. Has this died? It's on. I've been using it, but I think the batteries have died because the red part has gone off also. Can you operate the slides for me until we get some batteries? I was like, it's not advancing. Okay, so prevention of heart disease. What are some of the things you think about when we talk about prevention of heart disease? Everyone's looking at the screen. Walking, movement. I have a little sticky note at my desk that says, movement is medicine. That's the best kind of medicine. I would rather use that kind of medicine than to have to pop pills or take medication. But walking and exercising help to squeeze the heart. The harder the level of exercise, the harder that heart muscle is going to squeeze. Eating healthy, so having a diet that is low in cholesterol, low in fat, and low in salt are the things that we think about when we think about heart health. When I talk about low sugar, that's usually diabetic month, but low sugar also kind of comes into play with the heart as well. Because if you're diabetic, you are bound to have heart disease. So taking medications as needed, whether it be for high blood pressure, whether it be blood thinners to thin out your blood, whether it be medications that are designed to strengthen the heart muscle or to take pressure off of your heart valves. We use many types of medications to try to prevent heart disease. Attending your regular appointments can be helpful with prevention, whether it's with your primary care doctor or whether it's with your cardiologist. Regular monitoring of your blood pressure and making sure that your cholesterol levels are being checked. I always tell patients at a minimum, your cholesterol levels should be checked 1 time a year. If they are normal, then 1 year is appropriate. If they're abnormal, they should be checked every 6 months. Or if you're on cholesterol-lowering medication, we should check them every 6 months. So that is part of our routine blood work that we do in the clinic for patients. Getting adequate sleep is also very important. Our heart needs to rest. So in times of rest, you can imagine our heart rate is lower. And then times of activity and stress, our heart rate is higher. So it's very important for us to get good, adequate sleep so that our heart can rest, our body can reset. Those cortisol levels from anxiety and whatnot can be lowered during sleep. So the next part is managing your stress levels. That can be done whether it be through meditation, whether it be through yoga, exercise, walking. Some people need medication to treat anxiety, which then can help at least feel like their stress is a little bit lower. And then with Curana, we also have behavioral health here at River Landing. So we have a talk therapist. Her name is Jackie Brown. It's technically called psychotherapy, but it's basically therapy for your mind and for your stress level. So just like we take physical therapy to strengthen our body, or we take speech therapy or occupational therapy, talk therapy is also available. And it's a Curana health provider who comes to River Landing for that. And then lastly, we also have behavioral health. We have psychiatry with Curana. So if someone is needing a lot of medication adjustments with their anxiety or depression, then we can help facilitate that as well. Next slide, please. So walking and exercising often. I often get this question, how many steps a day? And I say, as much as you can. I don't want you collapsing in the parking lot or, passing out. But aiming for 7,000 to 8,000 steps per day is going to be great for your heart health. That is going to help improve your circulation, lower your blood pressure, and boost your mood. I do remind people that if you're actively walking and then you just sit right down and check your blood pressure, you may get a high reading. And so I've had that question of, well, how is it helpful to my heart to walk if my blood pressure is high? That is the normal response to exercise. So just like if someone jumps out and scares me and I'm alarmed and I have that fight or flight mode, my heart rate's going to increase, my blood pressure's going to increase, but that is actually good for my heart. So walking, exercising is going to increase your heart rate, just like someone scaring you or jumping out in front of you. It's going to increase your blood pressure in the moment, but then within 10 to 15 minutes after sitting and resting, then your blood pressure should become lower. So don't ever check your blood pressure in the wellness center. Don't check your blood pressure right after exercise. I don't recommend that. I definitely recommend resting. Let's see. So walking is helpful for the heart. It's also helpful for the bones. And I tell people walking with extra weight is helpful for the bones. So if you have osteopenia or osteoporosis, you can put wrist weights on, you can put ankle weights on, you can put a weighted vest on. I hear some ladies giggling over here. And I will tell you, so there's something I learned many years ago. People who carry a little extra weight, a little overweight maybe, they rarely have osteoporosis. Usually the people who have osteoporosis are thinner, smaller framed females after menopause, and they just lose that bone density. But if you find a heavy set male or female, their bones are usually good and strong because they're carrying around that extra weight. So extra weight can be helpful, maybe not for your heart, but it can be helpful for your bones. So don't forget that. Walking with a group can be helpful to keep you motivated, maybe keep you accountable to doing it. So calling someone up and say, let's meet, let's go walk, let's make a few laps around the golf course, or let's just walk through the building. That can always be helpful for you too. Next slide, please. So eating healthy, making sure that we are eating things like leafy greens, nuts that have healthy fats in them, berries and fish can be very helpful. Many of you take fish oil capsules as a supplement to try to improve your heart health. And that is certainly beneficial. You can also just increase the fish in your diet too. Yes, it's working. Good. I thought I was losing it a little while ago. I thought, well, it was working. What's going on? Um, the key to heart health is also reducing your processed foods. You guys have heard me say over the past year, if it comes in a box or a bag, it's been altered. It's not natural usually. Natural fruit, natural foods are things like fruit, vegetables, things that come from a plant or a tree or the ground. And then if it has a mother, I always say, if it's animal based, that is going to be not necessarily processed. So fresh meats, fresh fish, fresh vegetables, fresh fruits, things like that are going to be healthier for you. And they're not going to be as high in trans fat and saturated fats. So it's trans fat and saturated fats that contribute to the coronary artery disease, the blockages in our heart arteries. And that is also what will contribute to some of your elevations in triglycerides and cholesterol levels. Eating heart healthy also means limiting sodium. There's a lot of salt in processed foods. So things especially like soups, deli meats. I think things we already know about are things like bacon, sausage, ham. Those things already have sodium in them. But most people don't think about deli meat. They think, oh, a ham sandwich is healthy. But that deli meat usually has a lot of sodium because it's a preservative. So you have to be careful about some of your sodium intake. Most people would not or do not know how much sodium they're taking in unless they are keeping track of it. And I know that's hard to do here at River Landing because we don't know how much sodium is in some of the dishes on the hot bar or, yes, Cindy? Ah, on CareMerge, nutritional information for every item. So even hot bar, soups, they have it all listed. Okay, I've seen the restaurants and I've seen the menus. I did not see the nutritional content. Elaine, was that your hand? Ah, a meeting Friday at 1:30 with Joseph about the sodium content. She said there's a question about some of the reliability of that information. Sure, nothing's perfect. Mm-hmm. Yeah, good. And I'm sure they are doing the best they can with what they have. And I always tell patients in the clinic, preparing for large numbers of people, you know, it might be easy to make a pot of soup at home and be able to monitor how much sodium is in that. But when you're large batching food to put out for the hot bar and you've got it for the restaurant and the bistro, you know, there's lots of different factors that go into that. So sodium is what is going to play a role in your blood pressure. It's going to play a role in the thickness of your heart muscle. So it doesn't play a role in the electrical activity of your heart, but the thickness of your heart muscle can play a role in the electrical activity. So it's interesting just how everything cardiac is related. Actionable idea here is to use herbs and spices instead of salt to flavor meals, trying to choose things like whole grains over refined grains, brown rice over white rice, things like that are helpful. And then, of course, just practicing portion control. Not taking more onto your plate than what you're going to eat, and then not feeling bad about disposing of some food. I know I came from a generation when my parents said, you don't get up from the table till you finish your plate. And, that's not such a healthy mindset now, because that's forcing children to eat everything on their plate. Even if they aren't hungry, they are being forced to eat extra calories. So definitely, trying to think what my husband's grandfather used to say. Eat what you take and take only what you're going to eat. And I liked that. So just be mindful. Start out with small portions. If you need to go back and get extra, you always can later. Taking medications as prescribed. I always think about how can we stay on focus with taking our medications. One is something that I am going to order for the clinic are medication lists. What I find frequently is a lot of people don't know the medications that they take. And they say, well, you've got it. And I say, well, I have a list of what we have prescribed, but what I don't know is if a specialist has added something or adjusted a dosage. I don't always get that information from them. And so it's very important that everyone, either in your smartphone, if you have one, have a list typed for what you are taking. That's the medication name, dosage, and how frequently you take it. Or I'm ordering these Curana health cards that have the space for a medication list so that you can carry that. I know some of you use a rollator, and it's helpful just to have your medication list right there in the rollator. And then also on your information sheet that's on your refrigerator, having it there and keeping that updated is very important. But helping to remember to take your blood pressure, cholesterol, and antiarrhythmic medications, pill organizers, pill boxes. This talks about smartphone apps, but just setting a reminder. You can tell your phone, hey, I'm not going to say it, Siri, and it will, you can say set a reminder for 11 a.m. every day to take blood pressure medicine, and it will do that, and it will alert you and help you try to stay on track with taking your medications. Again, keep an updated list for emergencies and share it with your team. Every visit you go to, you should provide that provider with your list of medications. And then notify your PCP if you have any side effects or changes. This is just about keeping your regular appointments so you can keep on top of your blood pressure, cholesterol, lipids, if you need an EKG or an echocardiogram. We have a EKG machine in the clinic, which means we can do an EKG and interpret it. Dr. Blake, I know, likes to order them frequently through National Mobile X-ray because that way a cardiologist is interpreting it. And then, of course, if you go to your cardiologist, then they do them in the clinic and they interpret those results. Echocardiograms, if you aren't familiar with what that is, that's an ultrasound of the heart. So that is where you're lying down, usually on your back or rotated to your left side, and they use the ultrasound probe around the chest to take pictures of the heart squeezing, the valves opening and closing, and they take measurements such as the thickness of your heart wall. Let's see, so just keep your regular appointments, monitoring blood pressure. I laugh at this. Blood pressure should ideally remain below 120/80. That's sort of some old data. The data now is that if you are less than 85 years of age, between 65 and 85, which is most of our group, then your blood pressure should be less than 140/90. And if you are 85 or older, we even allow that number to go up a little bit higher. Because what we know is that keeping the blood pressure too low causes people to fall, causes people to faint, black out, and then we have a whole list of other problems that can occur, whether it be a fracture, whether it be a dislocation, a brain injury, or a bleed in the brain. So things can happen when the blood pressure is too low. So it's all about balance, but 120 over 80 is no longer the norm for people age 65 to 85. Cholesterol goals really haven't changed a whole lot. The LDL cholesterol is our bad cholesterol. If you want to try to remember how to keep up with LDL and HDL, I always say LDL, you want it low. HDL, you want it high. So HDL is the good cholesterol. You want that as high as possible. And LDL is the bad cholesterol, so you want that one as low as possible. So generally, LDL should be under 100, and HDL would be above 60. I've got some people in this room that they are go-getters, and their HDL is like 90. And I tell them they win the award for River Landing's highest HDL. So it can happen. One way to try to raise the HDL is exercise. But you still have marathon runners who have problems with their cholesterol. So, and some of that is familial. It's hereditary. It's going to happen because it was a condition that their parents had that ran in their family. So there are medications that are geared towards familial problems with cholesterol. But ideally, to try to get the HDL up, you want to walk with extra weights, or exercise where you're getting your heart rate up and keeping it sustained at a higher level for at least 20 to 30 minutes. Trying to invest in a reliable home blood pressure monitor can be difficult. The difficulty with monitoring blood pressure at home is that they usually have wrist monitors and they have arm monitors. And it can be quite cumbersome trying to get that blood pressure cuff on your arm by yourself, getting it in the right location, getting it tight enough but not too tight, because if you get it too tight, then you're going to get an elevated blood pressure reading. So it can be a little difficult. I do tell people that if you want your blood pressure checked, you can come to the clinic, and we'll have you sit usually in the room for 5 to 10 minutes. I dim the lights, I turn on the little white noise sound machine, bring your monitor with you, and we will check your blood pressure manually with our cuff and a stethoscope, where we are physically listening to the changes in those numbers, and then we can also monitor it with your own automated cuff. They're never going to be the same. There's always going to be a discrepancy, but at least we can kind of determine, is your cuff off by 5 or 10 points? Is it off by 10 or more points? So we can know how much reliability to place in that home cuff. So it can be difficult finding one that you like, finding one that's easy to use, that's not too complicated. You can always ask the pharmacist. They usually have several different models that are available at the pharmacies. And then just being proactive and tracking your cholesterol levels when you have these routine labs. And of course, I always say, if you have numbers that are mildly elevated, then that is always a warning sign. It's like, it's trying to get your attention. Hey, it might be time to start doing something about these cholesterol numbers. So don't ignore those numbers, when they're 10 points high, 20 points high. I don't get too alarmed, but I do tell patients this is our warning. This is your body's way of telling us that things are starting to get a little bit out of the normal range, and we need to reel things back in, usually with lifestyle changes. So if you're not living a heart-healthy lifestyle, you could be at risk for things like a stroke. We don't typically talk about strokes much when we talk about the heart, because a stroke is a condition where the blood flow to the brain is compromised. But it's very important just as well, because if you have blockages in your heart arteries, you likely have some blockages in the arteries that are going up the neck to the brain or in the brain themselves. So that is what happens when you have a stroke. You have a portion of the brain that is compromised from blood flow, and that area of the brain dies. And so then you can have physical limitations, usually on one side of the body or the other. You can have some mental limitations, things like memory changes, personality changes. Lots of different problems can occur from having a stroke. You're also at risk for high blood pressure if you're not trying to live a heart-healthy lifestyle. You're at risk for atrial fibrillation. Atrial fibrillation is one of those electrical abnormalities of the heart, and I like to best use my hands when I describe AFib. When I worked with the electrophysiologist at Navant, he would use his hands, and he would say, picture that you have two chambers on the top, two chambers on the bottom, and that's how our heart is made. So you have the atria and the ventricles. And typically, in a normal pattern and a normal electrical system, you get a squeeze of the top and you get a squeeze of the bottom. So you typically get boom, 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 boom. But in atrial fibrillation, it fibrillates. So the top chambers are not squeezing as they should, so they are not exuding or pumping blood out of the top chambers. They're kind of quivering and fibrillating, but your bottom chambers are still beating. So you're getting a boom, 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 and it's usually very irregular because this is not a normal rhythm telling the bottom to beat normally. You will get a boom, 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 boom. I mean, it is just, I always say it's like a song and it's just beating to its own little drum. So that's what atrial fibrillation is. And atrial fibrillation puts you at risk for a stroke. And the reason for that is because when those top chambers are fibrillating, the blood can pool and it's not getting pumped out. And so when the blood pools, it can become thicker and then it clots. And so you can get a blood clot in the top chambers of the heart, the atria, and with this quivering, sometimes little pieces will break off. And those pieces break off, and they usually go to the brain, and that can cause a stroke. So that's why if you have atrial fibrillation, you're usually on a blood thinner. At the very least, you're on aspirin, but typically a prescription strength blood thinner, and then usually on some type of heart or blood pressure medication to try to regulate the heart rate. Another heart condition that can develop if we're not living a heart-healthy lifestyle is congestive heart failure. That goes back to that structural abnormality where the muscle gets kind of relaxed. It can get thick. It's not squeezing efficiently. I'm such a hand talker. It's not squeezing efficiently, and so it just kind of sometimes barely moves, and so then the efficiency of the blood getting pumped out to the body, it's not as efficient, and so people can develop swelling in the legs, ankles. They can become short of breath when they're walking or talking. They can have difficulty lying flat at nighttime because when they lie flat, they feel like they're smothering, and then they have to prop up. So congestive heart failure is typically a condition where the muscle is weak, floppy, or thick, and can lead to other symptoms. And then a heart attack is where we get blockages. So that's where the arteries that run on the outside of the heart, feeding that heart muscle, those arteries get the calcium and cholesterol plaques built up inside of them, and then it compromises blood flow to that portion of the heart, kind of like a stroke. It's like a stroke of the heart. That part of the heart can die, and it's not getting the blood flow, so therefore it's not going to pump as efficiently and work as well as it should. So heart-healthy lifestyle is very important to try to prevent all of these conditions. So again, I'm not going to spend a lot of time on this because I think most people know what high blood pressure is, but it's an elevation of the pressure in the arteries, either during the working or relaxed phase of the heart. And it's usually a chronic condition. So you don't usually get high blood pressure and eventually get to stop your medicines. It's usually a chronic, lifelong condition that you will remain on medications. Although the very first recommendation for high blood pressure, the first treatment, is diet and exercise. So if you have a young person in their 20s or 30s, they've never had high blood pressure before, the very first instruction, depending on how high that pressure is you need to exercise and you need to eat healthy, and that's the first treatment. And then the second treatment, sometimes initiated that same day, is, okay, now we need to begin medication to lower your risk of complications. Some of the problems that can come along with high blood pressure symptoms are headaches, vision changes, shortness of breath, and nosebleeds. Stress is a major cause of high blood pressure. So another reason for us to try to be calm, cool, collected, and manage our stress. Our age plays a role in developing blood pressure. Our race plays a role. African Americans are at higher risk for developing hypertension than Caucasians are. If there's a family history of high blood pressure, doesn't mean you will get it, but it means that your chances of getting it are increased. Carrying that extra weight is going to contribute more to elevated blood pressure readings. If you're not exercising or if you're smoking, vaping, all of those things can increase the risk of high blood pressure. If you're taking in too much salt, and again, some of what we get is not possible for us to regulate. So I do tell people with high blood pressure, push that salt shaker away. Don't add extra salt to your food, and that will help keep your blood pressure lower. And then, of course, managing stress, like we talked about. Here we are. I jump a little out because I just talk from my brain and not from these slides. But exercise and diet changes are the top two lifestyle changes that are recommended when you have high blood pressure. Reducing your stress, getting good sleep, and then, of course, medications. We talked about the quivering or the fibrillation that occurs with atrial fibrillation. It's where it's shaking so fast that it doesn't contribute to the blood being pushed out of the top chambers of the heart. It's an electrical problem. It can come on acutely. You've never had it before and you develop it. Sometimes the cardiologist can shock your heart back into rhythm and it goes away and never returns. But more often, as we see in people age 65 and older, it becomes a chronic condition. You're either living with atrial fibrillation or you're on medication to try to prevent it from recurring. AFib can come from heart failure. So some people don't know heart failure. They have heart failure until they get diagnosed. And then often soon after that, we see an electrical problem. Heart disease like blockages and also valvular heart disease, leaky valves, can also contribute or cause atrial fibrillation. Some people don't know they have atrial fibrillation. They feel fine. They think everything's going along great, and someone puts a stethoscope on their chest, and we listen, and we hear that just all over sounding like Little Drummer Boy with a rhythm that doesn't make sense, and then that's when we suspect atrial fibrillation. But more often than not, it can cause people just to be weak. Their heart's not pumping efficiently. They're not getting the oxygen that they need, so they're short of breath, they're dizzy, they just don't feel well. It's often diagnosed when a person has a stroke. So they don't know they have AFib, they have a stroke, and then they're in the hospital or emergency room, and then that's when we hear the abnormal rhythm. So you want to make sure that we're always listening to the heart and lungs every time you go to your providers. Maybe not your podiatrist or dermatologist, they don't care. But your primary care doctor, your cardiologist, your lung doctor, everyone should be taking a listen to your heart. Treatment is, as I talked about earlier, it's usually to help control the heart rhythm and to prevent clots. It's usually twofold. So we're usually trying to make sure that the heart rate stays low or controlled, and we are trying to prevent a clot from forming because we don't want someone to have a stroke. Congestive heart failure is that excessive fluid that builds up. It can build up around the heart, it can build up in the lungs, and then the fluid, of course, because of gravity, it can build up in the feet and ankles. So that's why I'm always listening to the heart and the lungs and the abdomen and the neck, and then I always check your ankles to see if you have any swelling. Again, it's caused by a lot of these other heart conditions, but congestive heart failure can come from an infection. There are certain infections that can attack the heart muscle, and also excessive alcohol consumption. So I do remind people that if you drink much, keep it in moderation because too much in excess can damage your heart. And again, shortness of breath, swelling, chest pain, exhaustion. And one thing that's not on here was I talked about the inability to lie flat. If you can't lie flat and breathe, then that is concerning for you may have fluid developing in your lungs. Lifestyle changes, medications, and the key with heart failure is monitoring your weight. I always say it's a first thing in the morning weight. Get up in the morning, urinate, empty your bladder, take your clothes off. So it is a naked, dry weight, meaning no clothing, no shoes, no phones, no jewelry, and it's after you've emptied your bladder. And if you're keeping track of if you have heart failure, you should be keeping track of your weight every morning. If your weight goes up by 3 pounds or more in one day, then that's concerning that you're developing some increased fluid retention, and then your provider needs to know about it. Again, a stroke is the lack of blood flow to a part of the brain or a rupture of the blood vessel in the brain. Causes of stroke are similar to causes of heart attacks. Cholesterol plaques can build up and then rupture. It interrupts the blood flow to the brain. Again, with AFib, because it's fibrillating and the blood is pooling, you could break off small clots that cause a stroke. And then weakened vessels from high blood pressure can actually cause strokes as well. Symptoms, facial weakness or weakness on one side of the body or the other, paralysis, sudden blurred vision, double vision, or loss of sight, dizziness, sudden or severe headache, and inability to speak or speak well. So one of the things I always do when someone tells me they're there with a headache or they're there with dizziness is I will do a neuro check. I will say, smile at me. And I want it to be symmetrical. I want it to be the same on each side of the body. I'll have them stick their tongue out at me. That tongue should go straight. It shouldn't go to the left or to the right. I will say, hold your arms up for me. And if they can hold their arms up and one of them's not drifting, or maybe they do this, that's not a good sign if only one arm is working and the other one's not. So I check strength, I check for weakness in both the arms and the legs, and then I try to get them to talk to me. If they are trying to speak to me and they don't sound normal, that's pull a cord moment. Time is of the essence when someone is having stroke symptoms or if someone is having heart attack symptoms. So time is of the essence. If someone calls the clinic and tells me they're having these symptoms, I usually don't even have them come to the clinic. That is a medical emergency. That's not appropriate for a primary care clinic. That's a pull the cord in your apartment or in your home and get EMS here. So again, this is in red because that's emergency medical care. And then, of course, after a stroke, you're going to need close follow-up with your primary care provider. You may also be assigned a neurologist or a cardiologist after a stroke. Heart attack, again, is similar to a stroke. It's just where there's a lack of blood flow to one of the main arteries in the heart. Cholesterol, stress, smoking, obesity, and family history all raise your risk for heart attacks. And this is where I like to focus on signs and symptoms. It is different for everyone. If you've ever known someone who had a heart attack, you should ask them, what symptoms did you have? Oftentimes, I was out playing golf and I just got dizzy. I just didn't feel right. I felt dizzy. I didn't have chest pain. I thought I was dehydrated. I passed out. It's not always the typical clutching the chest, the elephant sitting on the chest type symptom. So it can be different for everyone, and including women. Women, we don't have that typical clutching the chest symptom like men can. And if you're diabetic, you may not have any symptoms at all. You can have a heart attack and not be aware of it because diabetics can have silent heart attacks. So chest pain is the most common symptom, and some people go, well, I don't call it a pain. I say, well, further clarify that for me. Let's talk about it. Is it a heaviness? Is it a tightness? What is it? So some people would say, well, it's just a burning discomfort. And then we have to try to differentiate between, well, is this the heart or is this acid? Is this the stomach causing burning? So anything that is pressure, squeezing, sharp pains, chest discomfort, burning, or indigestion. And that could be most commonly while you're working your heart, meaning your heart rate is up, you can develop those symptoms. That means when you're putting your heart under extra stress to exercise or walk, if there's a blockage in those arteries and the blood's not feeding that muscle, then that muscle is going to cramp, just like a leg cramp would. But not always. It could happen at rest for you as well. Shortness of breath. I've had many people who just said, I just get short of breath, and I didn't used to. Like, I now can't walk from my living room to my bathroom without huffing and puffing. Well, most people think that's a lung problem, but it's not always. Sometimes it's a heart condition, or it's angina. It's those warning signs that the muscle's not getting the blood it needs. And then if you ever get pain radiating to your neck, throat, shoulder, or down your arm, people say right arm or left arm. Well, anytime, because it could be opposite, but your heart is on your left side, and so most of those symptoms are left-sided. But if you get it and you've never had it before and it's affecting your right side, that's still a medical emergency. You still need to get that checked out. Treatments, emergency care. So again, in red, that's nothing to play around with. Time is of the essence. Pull your cord, go by EMS, and get evaluated. You're going to need follow-up with your PCP and your cardiologist after that. For prevention, we say prevention is the key to all of these conditions. So make sure you are seeing your primary care provider. Make sure you are doing what you can do with your diet, exercise, level of activity, keeping your sodium levels in check, keeping your cholesterol levels in check. Make sure you're seeing your primary care provider, and you all can talk about the risks for all of these potential heart complications. There's probably a few more slides here, but I usually stop about this point because you all have already been listening for more than 30 minutes, and I know we start losing our attention. Who has any questions about high blood pressure, AFib, heart failure, strokes, heart attacks? Does anyone have anything? Yeah, Marilyn. So adequate water intake. She was asking about hydration. Adequate water intake does help blood pressure. If you are not drinking much at all, your blood pressure could be low. You could have hypotension, not hypertension. So if your blood pressure is low, you may inadequately be hydrated, and you may need to hydrate more. And oftentimes when you hydrate more, your vessels and arteries are becoming more volumized. They're plumping up, and so then that raises the blood pressure. Now, people say, for high blood pressure, what should I do? Again, I say drink more water. Avoid things that are going to increase blood pressure. Caffeine can increase blood pressure. We didn't talk about caffeine intake, but caffeine can increase blood pressure. So too much coffee, too much caffeinated tea, too many caffeinated beverages, too much chocolate, dark chocolate. Those things, everything in moderation. So all of those things could contribute to high blood pressure. But you're exactly right. Staying hydrated is going to help prevent low blood pressure, and then just staying hydrated is just important for any health condition, really. Unless you have heart failure. You might actually be on a fluid limitation if you have heart failure. Yes, Jack.
How reliable are Apple Watches in monitoring hearts?
Apple Watches and monitoring hearts. What's interesting is when I went to school, we were taught to check the pulse in the neck, check the pulse at the radial pulse, which is on this palmar surface of the wrist. You can check the pulse at the tops of the legs, behind the knees, tops of the feet, behind the ankles. But it's interesting that I wear my Apple Watch and it tells me what my heart rate is. I don't know the mechanics behind that or the reliability. It's better than nothing, but honestly, the true way to check the pulse is to find your pulse, look at the clock with the second hand, and count for 60 seconds. So count until that second hand gets all of the way around. That's your heart rate for that 1 minute. AFib, Apple Watches are not very helpful for that. AFib, again, is that erratic heartbeat. You might be beating 50 beats a minute, 1 minute, and the next minute, your Apple Watch may tell you you're 130. Well, the only accurate way is to truly do a manual count. So I think they're better than nothing, in my personal opinion, but they're not going to be 100% accurate by any means. I've had some people tell me that their watch told them they may have atrial fibrillation. And I think that's great. If your watch tells you that you may have atrial fibrillation, some people have told me their watch has told them they might have sleep apnea, because if you're wearing it while you sleep, it's picking up on noise like snoring or apneic episodes where you stop breathing. If it tells you that, you should come in and be seen and talk about it and undergo the appropriate testing for it. Any other questions?
Can you convert 7,000 to 8,000 steps a day into how many points in pickleball that would be?
Oh, yeah. I guess that would require wearing a pedometer and really, yeah. How many sets in pickleball is that? Yeah, Elaine.
I've heard that daily consumption of beets is great for controlling blood pressure. Is that true?
I personally do not know. I've never tried it myself, and I don't recall having a patient in cardiology who said, hey, I swear by this, this works. But there have been some studies out there. If you love beets, go for it. I could probably only handle beets in moderation. But sure, go for it. That's sort of like the apple a day keeps the doctor away. I don't know, keeps your bowels regular, but anyone else have any cardiology or heart questions? No? All right, everyone go for a walk before lunch, okay? It's nice outside. Thank you.